Hello, everyone. I am a volunteer with For a Safer Space. Today's presentation is about obsessive compulsive disorder. I would like to begin this presentation with a land acknowledgement, and this is for Toronto, where the Dish with One Spoon territory is located, as well as Toronto Metropolitan University. The Dish with One Spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. Today's agenda will include an introduction about obsessive compulsive disorder, followed by obsession symptoms, compulsive symptoms, causes and risk factors, treatment and therapies, and lastly, the conclusion. What is obsessive compulsive disorder? Obsessive compulsive disorder is a type of anxiety disorder characterized by a pattern of unwanted thoughts and fears, which are named obsessions, which cause you to engage in repetitive behaviors, which is named compulsions. These obsessions and compulsions disrupt daily life and cause significant distress. A person might make an effort to suppress or ignore their obsessions, but doing so only makes them feel more upset and anxious. In the end, a person becomes compelled to engage in compulsive behaviors in an effort to reduce their stress. Obsession symptoms. Obsessions are persistent and unwanted thoughts, images, or urges that enter the mind and cause distress. Number 1, fear of contamination. So refraining from normal activities such as shaking hands out of fear of contamination. Number 2, fear of harm occurring. So worrying about forgetting to turn off a stove or lock a door before leaving the house. Number 3, fear of dirt. Number 4, excessive concern with exactness. So objects that are not orientated in a specific direction or are not arranged in an orderly or symmetrical manner. Number 5, beyond normal focus on the need for orderliness. Number 6, anxiety related to unwanted thoughts such as anger or sexual or religious content. Number 7, anxiety about unwanted thoughts of hurting others or oneself. And number 8, anxiety about unwanted thoughts of cursing in public or other inappropriate behavior. Compulsion symptoms. A compulsion is a recurring behavior or mental act performed to provide relief from the distress caused by obsessions. These include cleaning, washing, repeatedly checking stoves, windows, or doors, mental rituals, repeating acts, repeating words, prayers, or phrases, and ordering or arranging things. Causes and risk factors. Symptoms often appear in teenagers or young adults, but they can start in childhood. Symptoms worsen when a person experiences stress. Obsessive compulsive disorder is a bit more common in women than in men. OCD risk factors include OCD in a parent, sibling, or child. Differences in the physical structure of certain parts of your brain, tics, depression, or anxiety, experience with trauma, and a history of childhood physical or sexual abuse. Following a streptococcal infection, a child may develop OCD. This is called pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections. Treatment and therapies. OCD is typically treated with medication, psychotherapy, or both. Number 1 being medication. To help reduce OCD symptoms, serotonin reuptake inhibitors and selective serotonin reuptake inhibitors are used. Serotonin reuptake inhibitors often require higher daily doses in the treatment of OCD than in the treatment of depression and may take 8 to 12 weeks to begin working, but some patients improve more quickly. If these medications do not improve symptoms, research indicates that some patients may benefit from antipsychotic medication. Number 2 being psychotherapy. Psychotherapy can be an effective treatment option for both adults and children suffering from OCD. Certain types of psychotherapy, such as cognitive behavior therapy and other related therapies, for example, habit reversal training, have been shown in studies to be as effective as medication for many people. Exposure and responsive prevention, cognitive behavior therapy, which involves spending time in a situation that triggers compulsions, for example, touching dirty objects, but then being prevented from performing the usual resulting compulsion, for example, hand washing, is also effective in reducing compulsive behaviors in OCD. Now we'll go over resources. The most important thing to take away from this video is that there's supports and help available. For immediate mental health crisis, reach out to a crisis line for support. For non-immediate mental health support, a useful resource is For a Safer Space. For a Safer Space is a nonprofit that offers accessible and inclusive mental health care. Visit the website for more information if you'd like to reach out for support. That concludes the presentation on obsessive compulsive disorder. Thank you for watching.